A Tri-City state senator says he will file legislation in Tennessee to protect people from drug-addicted nurses. Good evening, I'm Sarah Diamond.
And I'm Josh Smith. It's our top story tonight at 6. Republican State Senator Rusty Crowe says his proposal is the result of a community watchdog investigation. It comes 2 months after Nate Morabito exposed nursing board disciplinary delays that allowed some drug-addicted nurses to keep their licenses and even secure new jobs.
Yeah, Senator Rusty Crowe and his staff tell me they are putting the finishing touches on the legislation. Right now, the state rarely takes emergency action against a nursing license. Well, this legislation would allow the Tennessee Department of Health's commissioner or chief medical officer to suspend a license if a nurse fails a drug test. In past cases, a failed drug test hasn't stopped nurses from finding new work.
That offends me.
Almost 400 days. According to our review of state records, that's how long it took the Tennessee Board of Nursing, on average, to discipline area nurses for diverting drugs.
We simply shared our frustrations, but we're not unique. We're not alone.
Our investigation found lengthy delays in other parts of the state, too, including in cases where nurses tested positive for drugs. Nurses who still were able to land new jobs and put more patients at risk.
Something needs to be taken care of.
After seeing the results of our investigation late last year, Senator Rusty Crowe promised action.
We want every person that tests positive to be subject to suspension of license if we can show that that positive test doesn't relate to a prescription that they have to take that drug.
He says he's since developed legislation that would temporarily suspend a nurse's license.
Let's find a way to suspend their work through licensure while we're checking this out.
The emergency action would prevent the nurse from getting a new nursing job until the state licensing board completed its investigation. He's also proposing to change state law so that hospitals can more freely share information with potential employers about former nurses.
When you call and ask about the work status of an employee or about the kind of person they are, you need to feel comfortable that you can tell the truth through your human resource department.
This legislation is in addition to the internal improvements the Department of Health previously told us it made to reduce future disciplinary delays. Are there areas you all can improve to speed up the process?
We actively seek ways that we can improve our processes, and we think it's important to be responsive to our customers.
Senator Crowe calls his proposal a good start and expects plenty of discussion and possible changes once it's filed. Do you think this kind of legislation would pass?
I think so.
A big part of the legislation is that temporary suspension of nursing licenses for those who failed drug tests. That's something people on Facebook and Twitter told me they overwhelmingly support. Take a look at this. So the more than 250 people I surveyed on the topic, more than 90% said they support the idea.
Nate, thank you. The executive director of the Tennessee Nurses Association weighed in on this. She said she could not comment on the specifics, that is, of the legislation because she's not seen it. But by email, Sharon Adkins told us, quote, there already is a process in place for reporting healthcare providers who test positive for drugs without the appropriate prescription. They include but are not limited to reporting to the appropriate board for disciplinary action and or referring to a monitoring program and loss of employment.